This video talks about the popliteal fossa. We will identify its location, borders, and contents. I will select its module to show it better. The popliteal fossa is a diamond-shaped region situated posterior to the knee joint. It's the major gateway through which structures leave and enter the leg. The popliteal fossa is about 2.5 centimeters wide and has four borders that consist of the posterior muscles of the thigh and leg. The superolateral border is formed by biceps femoris. The supermedial border is formed by the tendon of semimembranosus and semitendinosus, while the inferolateral border consists of plantaris and the lateral head of gastrocnemius, and the inferomedial border is made up of the medial head of gastrocnemius. The roof of the popliteal fossa is mainly formed by skin and the popliteal fascia, which is continuous with the deep fascia of the leg. Important structures that pierce the roof of the popliteal fossa include the small saphenous vein and the posterior cutaneous nerve of the thigh. The small saphenous vein pierces the popliteal fascia and empties into the popliteal vein. The posterior cutaneous nerve of the thigh pierces the popliteal fascia as well, and its terminal branches connect to the sural nerve. The floor of the popliteal fossa is mainly formed by the capsule of the knee joint, the posterior surfaces of the femur and tibia, and popliteus more inferiorly. Now let's see the major contents of the popliteal fossa. I will fade the muscles to gain a better view of the contents. The main contents of the popliteal fossa are the popliteal artery, the popliteal vein, the tibial nerve, the common fibular nerve, the short saphenous vein, the posterior cutaneous nerve of the thigh, the genicular or articular branch of the obturator nerve, the popliteal lymph nodes, and bursa. The popliteal artery is the deepest structure, and it is a continuation of the femoral artery. The popliteal vein is formed at the distal border of the popliteus, as the anterior tibial vein unites with the posterior tibial vein to form the popliteal vein. The popliteal vein ends into the femoral vein. It usually lies lateral to the popliteal artery in the popliteal fossa. The tibial nerve and common fibular nerve are branches of the sciatic nerve. The tibial nerve descends centrally, and the common fibular nerve descends laterally, crossing the popliteal vessels posteriorly. The genicular branch of obturator nerve originates from the posterior branch of the obturator nerve. It enters the popliteal fossa and slopes on the popliteal artery to the back of the knee. The genicular branch of the obturator nerve innervates the knee joint.